Distinguished ladies and gentlemen, as you heard in the introduction, I'm here to present the briefing by the Permanent Secretary of the Ministry, Federal Minister of Environment, Mrs. Ibukun Odushate, who is unavoidably absent. It is our hope that she will be in a position to come personally on Friday, during the formal commemoration of the National Environmental Sanitation Day. The Registrar, Hurricane, directors of the ministry here present, representatives of MDAs here present, representatives of civil society organizations, our development partners, gentlemen of the press. It is my honor and privilege to welcome you to this press briefing, which marks the beginning of activities to commemorate the 2019 National Environmental Sanitation Day, which is on the 28th of June. The theme for this year's National Environmental Sanitation Day is Stop Open Defecation for Healthy Living. This theme underscores the seriousness of the problem of open defecation and its effects on the quality of our environment. It also calls for concerted efforts to address this mega environmental health issue for an improved living condition for the Nigerian citizenry. Open defecation is a problem that has been with us over a long time, and our several approaches and efforts to address this have not provided the desired results. You will recall that only about 6 months ago, Mr. President declared a state of emergency on water, sanitation, and hygiene, with emphasis on ending open defecation. Against this background, there is need for a more strengthened and all-inclusive approach to tackle the problem. The essence of declaring the 28th of June 2019 as the National Environmental Sanitation Day is to institutionalize sound environmental sanitation practices as a lifestyle amongst the populace through massive awareness creation and reward for innovative best practices in environmental sanitation, among others. Goal 6 of the Sustainable Development Goals, SDGs, which is clean water and sanitation for all, calls for global attention to the importance of environmental sanitation to the attainment of the SDGs, and it is quite apt on this occasion. It is important to note that open defecation and poor environmental sanitation make people sick, and for adults it means less income when they cannot work and more expenses incurred on hospital visits and medicines. It also makes children sick as it limits their ability to absorb nutrients no matter how much food they receive. As a result, a poorly nourished child does not grow up to be a healthy, productive citizen. Ladies and gentlemen, access to sanitary facilities remains a mirage to a vast majority of our citizenry. Today, 4.5 billion people of the world live without safe toilets, and 892 million people still practice open defecation. Hence, many people still use the bush and water bodies as their regular means for excreta disposal. Many institutions do not have sanitary facilities, and where they exist, they are not adequate functioning or they are misused. The undesirable consequences of poor excreta disposal lead to persistently high rate of diarrhea disease, which is the second cause of high morbidity and mortality, amongst children under the age of 5. Evident is also the persistent occurrence of annual incidences of cholera outbreak in some of our states, as well as the occurrence and reoccurrence of other sanitation-related diseases. These can be prevented through proper environmental sanitation and hygiene practices. In the effort to promote clean and safe environment, the ministry with other stakeholders is presently reviewing the National Environmental Sanitation Policy of 2005 and its guidelines on pest and vector control, school sanitation, market and abattoir sanitation, sanitary inspection of premises, solid waste management, and safe excreta and sewage disposal, constructing public toilets in public places, schools, markets, and so on. Recently, the ministry initiated a program tagged Clean and Green, and one of its major aims is to end open defecation by 2025. The ministry also provides toilet and other sanitary or hygiene facilities to communities under its community-based waste management program. In order to further strengthen the policy drive for addressing this problem, the ministry, in line with the decision of the 11th National Council on Environment, is in the process of developing a specific policy on open defecation and also setting up a sanitation desk in the 36 states of the Federation and FCT to enable the government to establish an environmental health and sanitation surveillance system. In addition, the ministry has commenced sanitary inspection of all federal government establishments, including federal government schools, ministries, parastatals, agencies, military and paramilitary barracks, public places such as petrol stations, abattoirs, motor parks, markets, and regulated food premises such as hotels and eateries. This sanitary inspection will be scaled up to all the federal government establishments nationwide to enable the ministry address the issues of open defecation, food safety, water quality, noise pollution, air pollution, waste management, pests and vector control, and the general environmental sanitation of the country. I challenge all stakeholders on environment at national, state, and local government levels not only to do the talking, but to take practical steps and actions individually and collectively as agents of change to ensure everyone, everywhere has access to an eco-friendly sanitary facilities, clean, green, and safe environment for sustainable development. In view of the foregoing, commemoration of the 2019 National Environmental Sanitation Day will include the following activities, some of which have already commenced. Number one, commissioning and handing over of a sanitary facility comprising 3 male toilet compartments and 3 female toilet compartments and 6 urinaries at Karu International Market, Nasarawa State. Number two, demonstration of a model ventilated improved pit toilet, construction and donation of 15 slabs to 3 communities, namely Kushingoro, Paduma, and Apoduse communities in Abuja FCT. Number 3, sensitization of community members and cleanliness exercise at Paduma community. The 4th activity is sanitary inspection of the 3 identified communities by the ministry's environmental health officers in collaboration with the Hurricane and Abuja Environmental Protection Board. And 5thly, National Environmental Sanitation Day commemoration on Friday, 28 June 2019. I want to use this opportunity to solicit support of development partners, NGOs, and the organized private sector for sanitation program of my ministry. This problem cannot be solved by one actor alone. My ministry will always invest in sanitation and regulate against pollution. The private sector should also provide the technology and resources needed to improve sanitation. I also call on civil society to continue to give water, sanitation, and hygiene, acronym WASH, W-A-S-H, high priority in their programs. Gentlemen of the press, it is our expectation that you will help to sensitize and enlighten the populace on issues of sanitation and hygiene, which are of global concern. I would like to end with a clarion call to action for everyone in this room. Let's make environment sanitation a priority and create a movement to stop open defecation. Thank you all, and God bless Nigeria.